Hello everyone, welcome back to the channel Target Nursing Officer. I hope all of you are doing well and staying consistent with your preparation. So in day 1 we have discussed the important concept and practice MCQs. If you have not watched the day 1 video, I strongly recommended you to watch it first, as today's session is a continuation of that video. So today is the day 2, and in this session we are going to practice high-yield MCQs that are very important for the nursing officer exams, AIIMS, NORCET and other MSc Nursing exams or competitive exams. So please keep your notebook and pen ready and note down the important points. So before starting the video, if you find this section is helpful, don't forget to like the video and subscribe to the channel and share it with your friends. So let's start without wasting our time. So previously we have done 20 MCQs, so today is 21. So the first question is to identify the correct statement related to the head and chest circumference. So you have to identify what is the correct statement related to head and chest circumference. The head circumference at birth is about to 33 to 35 centimeter. Chest circumference at birth is about to 30 to 33 centimeter. Head and chest circumference becomes equals around 12 months or all of the above. So for this question the correct answer is all of the above is the correct answer for this question. So as you know that the head circumference at birth is 33 to 35 centimeter, it is a correct statement, and also the chest circumference is 30 to 33 centimeter, it is also correct statement, and also the option 3 is a correct statement for this question. So all of the above is the correct statement. So next come to the question number 22. In a healthy child, the head and chest circumference is equal to each other around the age of what? The options are 3 to 6 months, 6 to 9 months, 9 to 12 months and 15 to 8 months, 18 months. So for this question the correct answer is option C, that is 9 to 12 months is the correct answer. So as you know that in a healthy child the circumference of the chest is about 2 to 3 centimeter less than the head circumference at the birth, but the circumference of the head and chest are almost equal by the age of the 1 year. So that the chest circumference exceed the head circumference. So next come to the question number 23. So what is the relationship between head circumference and chest circumference of a newborn baby? So options are both are equal at birth, head circumference at birth equal by 1 year, then CC exceeds. Then chest circumference more at birth and equal by 1 year, then head circumference exceeds. Then option D is none of the above. So for this question the answers is option B is the correct answer for this question. So head circumference more at birth and equal by the 1 year, then chest circumference exceeds. Then comes to the question number 24. So normal head circumference of a newborn is, so I think you don't need any options because it's a very easy questions. So the option D is the correct answer for this question. So normal head circumference of a newborn is 33 to 35 centimeter. Then comes to the question number 25. So normal mid upper arm circumference, that MIWAC at birth is about to 6 to 8 centimeter, 9 to 11 centimeter, 12 to 14 centimeter and 14 to 16 centimeter. The options. So the correct answer for this question is option B, that is 9 to 11 centimeter, that is the MIWAC at birth. Then comes to the question number 26. The best method to perform physical examination on a 2 years old child is, options are proximally to distally, from head to toe, from least to most intrusive, then option D is abdomen to head. So for this question the correct answer is from least to most intrusive. Okay, so question number 26. The correct answer for this question is option C. So I think this is previously you have studied in your BSc time. So I think for this question you don't need any explanation. That's why I'm not giving. So next comes to the question number 27. So which assessment findings in a 6-month-old child needs further evaluation? So the options are absence of mororeflex. Option B is the closed posterior fontanelle. Then option C is the 3-pound weight gain in 2 months, and option D is moderated head leg on pull to sit. Okay, so for these questions the correct answer is moderate head lag on pull to sit. Okay, so this is the correct answer for this question. So I think it's a very important question, so that's why I'm giving you explanation why this is. So mainly head controls is expected at the age of 3 months. Okay, so starting at 6 week head control develops, and there is only a slightly lag at 12 weeks of age. But infant lifts head from supine position when pulled off at 5 months of age. So head lagging in 6-month-old infant required attention. So all other findings are normal for the 6-month-old infant, but the option D is not means not a normal findings in a 6-month-old baby. That's why it's need for the evaluation. So all of you understand this question. So next comes to the question number 28. So maximum absolute growth is seen at which years? 0 to 3 years, 3 to 5 years, then 5 to 10 years, then 14 to 16 years. So for this question the answer is option D, that is 0 to 3 years of age, that absolute growth is seen at a baby. Then question number 29. Identify the high risk infant among the following. The options are infant with birth weight 2.5 kg, infant on a artificial feeding, infant weight with birth weight 2 kg, then infant with Apgar score 8. So for this question the correct answer is option C, that infant with birth weight 2 kg is coming under the high risk infant. Okay. Then comes to the question number 30. So premature closure of the sagittal suture is called scaphocephaly, oxycephaly, acrocephaly, anencephaly. So for this question the correct answer is option A, that is scaphocephaly is the premature closure of the sagittal suture. Okay. So next comes to the question number 31. So the average length of a normal newborn baby is 45 cm, 50 cm, 43 cm and 35 cm. So option B is the correct answer for this question, that is 50 cm. Then comes to the question number 32. So all the following are normal manifestation in the newborn except. So in this question you have to identify which of the following is not a normal sign and symptoms of a newborn baby. So option A is a uneven head shape. Then option B, irregular respiration, that is 30 to 60 per minute, beat per minute. Then option C, positive mororeflex, and option D, heart rate 80 beat per minute. So for this question the correct answer is option D, that is heart rate is 80 beat per minute is not a normal clinical manifestation for a newborn baby. Okay, so next comes to the question number 33. So macrosomia means. So macrosomia baby means. The options are baby with large tongue. Option B, baby with large head. Option C, large size baby. Then option D, baby whose weight is not adequate to length. So for these questions the correct answer is option B, that is the large sized baby is known as macrosomia baby. Okay, so next comes to the question number 34. So correct regarding the fontanelle is. So option A, anterior fontanelle closes at 18 months. Option B, posterior fontanelle closes at 6 to 8 weeks. And anterior fontanelle is bregma. And option D, all of the above. So for this question, the option D is the correct answer. So, as you know, the anterior fontanelle closes at 18 months. Then posterior fontanelle closes at 6 to 8 weeks. And anterior fontanelle is bregma. So, all of the above is the correct answer for these questions. So, next comes to the question number 35. So, how much weight should a neonate gain after successful feeding? So options are 3 to 8 gram per day, 10 to 15 gram per day, 15 to 20 gram per day, then 25 to 30 gram per day. So for these questions, so option D is the correct answer. That is, the neonate gain after a successful feeding should be 25 to 30 gram per day. So next comes to the question number 36. So the mid upper arm circumference value is a moderately malnourished child is less than 11.5, less than 12.5, less than 13.5 and less than 14.5 centimeter. So for this question, the correct answer is option B, that if the MUAC value is less than 12.5 centimeter, then the child is coming under moderately malnourished. Then comes to the question number 37. So next comes to the question number 37. At what age does a child normally develop social smile milestone? So the options are 12 weeks, 4 weeks, 8 weeks, 16 weeks. So for this question, the correct answer is 8 weeks, that is nearly equals to 2 months. So by the 2 month of age, child develops social smile. Baby also looks at parents, then cooks and makes gurgling sound. Then question number 38. So brain growth is at its maximum during the third semester of pregnancy, infancy time period, adolescence period and school going period. So as you know, in the correct answer is infancy. So when the baby is in infancy period, so that time the brain growth is maximum. So next comes to the question number 39. So before going to 39, so we just read some explanation for this question. The last 3 months of pregnancy and first 3 years of postnatal life are the most crucial for brain development of a child. So next comes to the question number 39. Crawling of an infant occurs at 6 to 9 months, 2 to 3 months, 4 to 5 months and 8 to 10 months. So for this question, the correct answer is 8 to 10 months. That is option D. Then comes to the question number 40. An infant sits alone momentarily but about dash month of age. So the options are 6 month, 4 month, 8 month, 10 month. So for this question, the correct answer is option A, that is 6 month. So next comes to the question number 41. So a male baby will have an optional head circumference of 45 centimeter at dash age. Dash age. So the options are 3 month, 4 month, 12 month and 9 months. Sorry for the mistakes. So for this question, the option C, that is 9 month, is the correct answer. So according to WHO growth chart, that 46 centimeter at 12 month, okay, and 45 centimeter at 9 month. So for this question explanation, as per WHO growth chart for boys, head circumference is about 45 centimeter at 9 months and 46 centimeter at 12 months. So that's why the correct answer is 9 months. Then comes to the question number 42. So which of the following is a milestone typically achieved by a child within the first month of life? Options are rolling over independently, lifting and turning the head, then crawling and sitting independently. So for these questions, the correct answer is lifting and turning the head is the correct answer for this question, that the child can do lifting and turning the head at the first month of life. So then comes to the question number 43. So which of the following is a milestone typically achieved by an infant at around 9 months of age? So options are walking independently, crawling, saying simple words, rolling over. So for this question, the correct answer is crawling. That is the crawling. Crawling can do by an infant at the age of 9 months. Okay. So next comes to the question number 44. So anterior fontanelle is closed at less than 3 months, 12 months, 12 to 18 months and 3 years of age. So previously also I have told you this question. So any guess? So for this question the correct answer is 12 to 18 months. So anterior fontanelle is closed at 12 to 18 months. So it is a very important question. So in every exams it comes. Okay. So next comes to the question number 45. So a 1-year-old child comes to well baby clinic and nurse notice the child's anterior fontanelle is still open. What is the appropriate nursing intervention? So options are report to doctor, normal findings, measure head circumference, look for sign and symptoms of infection. So again I repeat this question because it's a very important and tricky question. So that a 1-year-old child comes to the well baby clinic. Okay. So and nurse noticed the child's anterior fontanelle is still open. So what is the appropriate nursing intervention for this child? So any guess? So the correct answer for this question is it's a normal finding. So as you know, the anterior fontanelle is closed at 12 to 18 months. So that's why it's a normal findings. So then comes to the question number 46. So a child likes to look at self in a mirror at the age of 6 months, 8 months, 10 months, 12 months. So for this question the answer is option B, that is 8 months. Okay. So then comes to the question number 47. So a 3-year-old child cannot draw a circle, knows gender, draw a square, ride a tricycle. So for this question, so you have to find out which of the following is cannot be done by a 3-year-old child. So any guess? So option C is the correct answer, that a 3-year-old child cannot draw a square. Okay. So as you know, a child is able to draw a square at approximately 4.5 years of age. So that's why that's why a 3-year-old child cannot draw a square. Then comes to the question number 48. So a 3-year-old child is said to have delayed milestone if he fails to. Options are use spoon, draw a square, skip, then climb with alternating foot downwards in the steps. So for this question the correct answer is option A, that is use spoon. So if a 3 years old baby is not hold the spoon, or he is unable to use the spoon, that's why there is a delayed milestone. Okay. So then comes to the question number 49. So popcorns and nuts should not be given to the toddlers because they will spoil the child's appetite and can cause tooth decay, are easily aspirated and have very little food value. So I think it's a very easy question. So for this question the correct answer is option C, that are easily aspirated. That's why the popcorns and nuts should not be given to a toddlers. So then comes to the last question, that is question number 50. So last question and very easy question. So the first appearing teeth in a child is, I think you don't need any options. So for this question the correct answer is option C, that is incisors. So first appearing teeth in a child, that is incisors. Okay, so that's all for the today's session. I hope these MCQs help you understand the topic better. If you found this video is useful, please like the video and subscribe to the channel and share it with your friends who are preparing for the nursing exam. And practice daily, stay consistent and keep believing in yourself. So thank you for watching and I will see you in the next class. Till then, tata and bye.